I had a patient about 3 years ago who came from another state, only about 40 years old, diabetic, and health-wise, obviously besides the diabetes, was not overweight, didn't have any heart disease, but had a wound on his heel. From his diabetes, he has neuropathy, so he doesn't feel a lot of things, and he works, and he developed this wound on his heel that got worse and worse and worse. And at 40 years old, married with kid, he was told you need a major amputation because his blood flow in his foot is terrible. And he's only 40 and he's walking, he has a life. And, three different places had said there's nothing but a major amputation. So, of course, being cocky is like, we can do something because he's coming desperate. Your patient comes vulnerable and you're young and you shouldn't have to face this at any age, but especially when you're young. Um, so I said, you know what? I don't care what they said, we can do something. And, the deep vein arterialization is something that I offer and I do. And I said, we'll figure something out. Get on the table, and the angiograms I had seen from this other state were very not detailed, which is very important when you're doing these things. And I saw what we call an orphan heel, which means that there's blood flow everywhere in the foot except for the heel. There's nothing. And I go, I really wish I hadn't promised a lot. That's one. It's like great. So then, I said, okay, I'm gonna just go ahead and do a DVA anyway. And um, to do a DVA, you need good venous circulation in your foot. You need the anatomy to work. And I committed to us. I got this. I'm gonna do it. So I get everything ready, get in the vein, do all. I got everything prepped, and it turns out his veins are not normal. I'm like, okay, so strike two, overpromised, shot myself in the foot. And it's humbling when you realize you have to learn how to set the expectations like we've talked about. So in that moment, I had already tried to create the DVA, then found out the venous anatomy is not normal in this patient. And so I had to come up with a way to get more blood flow. And although the DVA, which is supposed to bring blood down a vein instead of an artery because you have no arteries left, should go around your foot in the veins, it kind of just stopped at the ankle and escaped back up towards his heart, up his leg. So decided to, in interventional radiology, we do a lot of techniques with coils and this thing and that thing. So was able to take out a few vessels that I felt were stealing blood flow and redirected the blood flow towards the heel a little bit. And it was a shot in the dark. And the humbling experience happened in the room when I said, I came out and I told him in the family, I said, listen, I don't know if this is going to work. I'm not confident on this. I'm not confident ever when you're in a DVA scenario, but we're at this point. Um, I think there's a lot of spiritual help out there in the world, but somehow his DVA survived. He underwent several debridement skin grafts, and he was actually one of our a news story piece on Fox News. He's walking, and he has a foot, and it healed. But that's a good success story. But the points of that difficulty in that is saying how not to take on everything with confidence, how to set those expectations, how to reel back in your your emotional experience with that patient. And it's very humbling, and it humbled the heck out of me, I'll tell you, even doing complex things like DVAs. um, Finding out that maybe I should have said this may not work, done more detail workup. I don't like to stage my patients, I don't like to do that, but sometimes maybe I have to do that again. So it was a very humbling experience altogether. But the fact that it ended up in a success to the point where his podiatrist in this other state was shocked. He was telling his other friends, we need to learn more about this stuff. We need to work together. And that becomes viral out in other communities where they can find physicians. We can help connect them. So you never know how it springs.